women's empowerment first research study on access to economic resources during COVID-19 in the Ottawa, Gatineau, and Hull region. This is a study that we conducted over the summer, and I did this with the help of our researchers, Tracia Bedard, Gabrielle Lucente, and Priya Thomas, and it was funded by the City of Ottawa. Oh, yes, and it was funded also by our executive director, Mesera Teliesus. And thank you so much, Macy, for allowing us to have this study going. So to begin, I'd like to recognize that the Canadian Centre for Women's Empowerment is located on the unceded territory of the Algonquin and Anishinaabe. We extend our respect to all First Nations, Inuit, and Métis people for their valuable past and present contributions to this land. We'd also like to recognize the many women who have survived family violence and recognize their courage, strength, and acts of resistance and resilience. So just to give you a little bit of background as to who the Canadian Centre for Women's Empowerment is, we are the only national organization that's dedicated to empowering survivors of economic and financial abuse through advocacy and policy change, education, and economic empowerment. We're based in Ottawa, Canada, but we have staff all over the country. So I'd like to start off to give just a quick definition of economic abuse. Some of you may have already heard about this, but just to give a little recap, economic abuse is essentially a series of behaviors that an abuser uses to control their victim's ability to acquire, use, and maintain any economic or financial resources. The idea is for the abuser to keep the victim isolated and dependent on the abuser themselves. Economic abuse is divided into these three categories. So economic control. So that's when the abuser tries to keep knowledge of finances from the victim or from letting the victim have any financial decision-making power. Employment sabotage. Now this refers to the abuser preventing the victim from obtaining or maintaining employment and also education options. And then economic exploitation. So that occurs when the abuser intentionally engages in these behaviors that are meant to destroy the victim's financial resources or credit, and it often puts them in serious amounts of debt. So just before we begin, I would like to thank the City of Ottawa for providing the funds for our research study. Without their support, we wouldn't have been able to launch this research. We also want to give a special thank you to the Ottawa Coalition to End Violence Against Women, which is OCTAVA, and Homeless Hub, the Eastern Ottawa Community Resource Centre, Interval House Ontario, Cornerstone Housing for Women, and Harmony House. These organizations provided input to the quantitative survey that we ended up sending out to our clients and to the participants. So we're really grateful to have that input during already what was a difficult time. We also want to thank the survivors and victims who gave their time and experiences for the study. And we want to thank the Community Research Ethics Board in Ottawa who approved the study, and our volunteers and contributors who helped us push this over the finish line. So just wanted to go over some key findings that we found from the study, and just want to let everyone know that this is the first study of its kind that's done in Canada that focuses on economic abuse in general. Some of you may know that the Women Abuse Council of Toronto did a study in 2017 on financial abuse, but ours is the first study that actually looks at the holistic picture of economic abuse. So 80% of women in our study said their economic abuse increased during lockdown. So this included economic control, exploitation, and employment sabotage. They said abusers became more controlling, more manipulative, and more coercive when it came to victims' finances. Our participants let us know that their financial options and welfare benefits were severely limited by their perpetrator. And because of the financial constraints that their abuser put on them, and of course, because of the circumstances of the pandemic and lockdown, women were unable to leave their relationships or had to go back to the abusive relationship even after they had left. And our last key finding is that financial institutions among all the service providers that we had listed were ranked as the least helpful among all the services. So to give everybody a bit of background on the research design, we used a mixed methods cross-sectional research design. So our phase one, we distributed a survey that we actually adapted from the UK Serving Economic Abuse study. They actually just released their findings on the cost of COVID-19 recently. So we used the questions from that and we adapted them to the Canadian context. And this is where the local shelters and organizations came into play to figure out what was the information that they wanted to see from the study. We only took participants who were above 18 years of age, who identified as women, who of course experienced economic abuse, and the final sample size were about 121 women. Our second phase group was a focused discussion led in sort of an interview style, and we asked the participants about five open-ended questions with a few follow-ups, but essentially, what does economic safety during the pandemic mean to you? What factors might increase someone's risk of experiencing economic abuse? And what might protect someone against economic abuse? And what do you want decision makers to know about economic abuse? And how do you feel that your experience of domestic violence has changed during the pandemic? So to move on to our research results, just to give everybody a background on the demographics, you will see that that our study was mostly made up of white women, about 80% white women, and we did do our best to reach out to different participants of different backgrounds. We tried to send our survey to friendship centers, as well as other women of color specific shelters and organizations. But this was the amount that we got back for each demographic. But we tried to supplement that with our qualitative interviews. We held that with largely women of color and Indigenous women. 85% of the women were between the ages of 26 and 35. The majority of them had, around 32% had a high school degree, and about a quarter of them had some post-secondary experience. And another quarter of them had post-secondary degrees in college. So we also looked at the annual income for participants. So as you could see from the graph, the average income from the study was about $30,000 to $40,000 per year. And that's just a little bit less than the average income for women across Canada. Average income for women across Canada is about $43,000. Most of them were married at 70%. Only about 17% were single. And we also wanted to have a look at their living arrangements. So again, most of them were living with their current partner. Part of the study was adapted. We used the scale of economic abuse, which is an academically verified scale that's adapted from another study called Development of the Scale of Economic Abuse. It has a series of 27 to about 28 questions to identify what forms of economic abuse participants face. And this is the result for some of that. So 86% of the women experience employment sabotage at some point in the relationship. So that just means that the abuser tried to keep them in some way from going to work. 60% had their abuser threatening violence to make them leave work. 87% experienced some form of the abuser demanding them to quit their job. 70% faced physical abuse at some time with their partner if they did need to go to work. And 64% have had their means of transportation taken away from them. And this includes taking the car keys away to prevent the victim from going to work or going to interviews. So the economic exploitation part of the study, you see, I won't go through all the stats here, but you could see that over 84% at least of women have been exploited in this way. They've been threatened physically or physically hurt for paying the bills or even just buying things that they need. Victims have had their perpetrator take away their paychecks, their financial aid. A good majority of the women have had their money and their property stolen by the abuser. And a good majority of victims also were convinced by their perpetrator to lend them money, but were not paid back ever. As you can see, the abusers also built up debt under the victim's name, which we see is a very, very common experience of women who've experienced economic abuse. And even money that was sent aside for rent or bills was taken by the perpetrator without permission. We wanted to include a few quotes from the interviews that we had. So if you see on the left side from one of our participants, I left a stable financial situation, but there's nothing that helps women gain the financial situation when you're in the relationship. You are left to negotiate with your abusive partner. And that just goes to show that there's really no winning when it comes to a relationship with an abusive partner. You're left at the hands of that partner and the decisions that they make for the family. So the economic control portions, again, 84 to 95% of the victims were experiencing economic control, which is where things like the perpetrator demands to know where their money is spent, being asked questions constantly about receipts and getting change back from the victims after the money is spent for things like groceries. Many of these women have also had to hide their money from their abusers so that they don't spend it on gambling or spending it on anything that the abuser wants to spend it on. And 85% have had their money gambled with or shared without their permission, so given to other friends of the abuser without the victim knowing. Often what will happen is that if an abuser does decide to leave the situation, they'll take the money from their joint account and leave the woman with all the debt, which is what happened to our participants as well. So in general, when we looked at health and mental health and physical health concerns for participants, 39% of respondents said that they had a long-term or physical or mental health disability, and 61% didn't. The people who had disabilities indicated that they had post-traumatic stress disorder, depression, anxiety, diabetes, high blood pressure, and arthritis. 36% of those people were told to shield during COVID-19. And something that was brought up through the qualitative interview, so the focus group discussion, was that the mental health and physical health impacts were severely, they were very detrimental during COVID-19, especially because even in general, outside of the pandemic, OHIP tends to not cover certain medications that these women might need. So one of our participants shared that certain brand medications that her doctor prescribed for her because they just had specific benefits to her that the generic brands wouldn't. They're not covered by OHIP. So the participant can get these expensive name brand medications. So you have to resort to over-the-counter medications that are simply not sufficient for disabilities like the ones that you have. So when we look at the employment and economic resources during COVID, like I said, most of the women had seen their partners steal items from them before and during the pandemic, so 63% and 59%. 83% of the women either agreed or they strongly agreed that because of their abuser's action, their employment or education worsened since the start of the pandemic. 58% of the participants were working fewer hours, 10% were working from home, and 6% were let go. And a majority of the women agreed that they were concerned about their access to employment and education due to the current or former former partner's actions before and during, and even when we asked them to project after the pandemic. The majority of them also agreed that as a result of their abusers' actions, the employment or education situation had worsened since the start of the pandemic. And this is something common that we see because abusers typically, even when we looked at the literature from previous pandemics or weather-related disasters like Hurricane Katrina, what happens is when the state or the country shuts down and goes to an emergency lockdown, abusers will feel the stress of that. If they are working fewer hours, if they lost their job, if they are not having access to money. And the abusers, when they have this extra stress, they take it out on their victim. So we see that in our study as well. So during COVID, 70% of the participants said that they were living with the abuser. The majority said that they were worried about their housing situation due to the abuse before, during, and after the pandemic. Most of the participants also agreed that all throughout the pandemic and when they were asked to think after the pandemic, that they were worried about their housing situation because of their partner's actions. Like I said, abusers tend to keep rent money. They tend to prevent the woman from paying the bills. And so actions like this really become detrimental to their housing situation. 94% of the women had had their, like I said, their rent or bill money spent by the perpetrator without permission. And as you can see on the left-hand side, housing status is almost evenly split between people who were renting or who owned a property of their own. So most of the participants, around 70% of the participants, indicated that they agreed that their abuser had tried to control their money and finances during the pandemic, which was not a surprise to us. 40% had indicated that they did have plans to leave their partner before the pandemic, but we also asked if the women had succeeded in leaving, and only 5% of women succeeded in leaving their abuser during the pandemic, and 10% had actually had to come back due to financial constraints. So we saw that abusers also exerted a lot more control on their victims over welfare payments. So 30% of women who had received the Canada Emergency Response Benefit for COVID, or Ontario Works, employment insurance, or Ontario Disability Support Program payments, didn't know where that support money was going. And only about 18% knew where those allocations were going. So 65% and 60% of the people also believed that their partner had stolen items from them before and during the pandemic. 70% to about 80% agreed that they were concerned about their access to their employment and their education because of their abuser. And 84% also said that as a result of their partner's actions, their employment or education situation actually worsened during the pandemic. So when it came to seeking access to services, 38% of participants, the majority actually stated that their ability to access support slightly improved. 47% said that they didn't experience difficulty accessing help. However, a third of the population found that their ability to access services actually worsened. And we found that a fifth of the women did not seek help. And one reason that we believe that might be is because 64% of the women said that they felt unsafe calling services because their partner was at home with them during lockdown. As I said before, when we looked at literature, that was a common occurrence, that when the abuser is at home with them, there's simply no time or space away from the abuser to safely make a call and report your abuser to the authorities. We also theorized that the reason that access to support slightly improved is we also included hospitals, clinics, counselors, and family doctors as one of the service providers. And we saw that, and perhaps because the city was also funneling services towards those services more, because those services were coming online more, that those services the access to those services at least actually improved for these people. Another reason for that might be also is that the National Capital Region, so Ottawa, Gatineau Hull, because we're a capital city, we tend to have all of our emergency services located here. So the city was probably able to quickly bolster up those services, or a lot quicker than any other region. So you could see from the chart a little bit the ratings for how helpful these women found particular organizations. So just some key highlights were that women's shelters and homeless shelters were ranked amongst the most unhelpful range. So 27% and 31% of women ranked them in the unhelpful or helpful or very unhelpful range. But we know that to be the case also because when we heard from shelters themselves and women's organizations, they were severely understaffed, underfunded, and overburdened. They were just over capacity. So that was something that we were expecting. The participants had really good ratings for counselors, doctors, mental health support. So 41% of women rated those organizations as helpful or very helpful. This was followed by daycares and child maintenance at 38%. And then women's shelters as well were also ranked in the helpful range at 36% of women, and then hospitals or clinics at 35%. So just some of the top scores there. So around 50% of participants said that they agreed that they felt more unsafe calling police services, shelters, women's organization because their abuser was at home. We found also by speaking to the women through the interviews that some programs for older women were lacking because often the services that are available are ones for young mothers, but the needs are just simply different for those of the elderly. So that was something that the participants brought up as sort of a gap in service providing. Civil court services were also lacking because victims of abuse, they currently just don't have a dedicated program to be referred to. Instead, we heard that a lot of these women, when they went to court services, they were referred to a program for men that's called New Directions Program. But that program is more of an anger management and a abuser sort of reform program. But what you're essentially doing is you're lumping victims and abusers together in an unsafe environment that's really not meant for a victim. We constantly heard from our participants that we just need more. We need more people working in healthcare. We need more people working in community centers, social workers, and counselors, because when someone is in that much distress, they don't know what they need. When someone comes out of an abusive relationship, as many of you might know, the impact on the mental state and the physical state is such that you might even forget what you need. One of our participants who was in the interview let us know that when she even got to the shelter, she had been in survival mode for so long, and the shelter workers asked her, "What do you need? Like, what can we give you?" And she just didn't know how to respond. It took her a full 24 to 48 hours to actually process what had happened to her and then be able to ask, okay, yes, I need diapers. I need this for my children. I need these certain types of food. But it takes a significant amount of time to be able to just process that. So another thing that we found that at least our participants brought up to us is that what they find from their perspective is that people who find that they are not experiencing the situations aren't the ones with the voice. They're not the ones making the decisions at the table for funding it and how it's allocated. And that was sort of a point of frustration for the women. So we also noted some systemic issues that were exacerbated by COVID. And that includes racial discrepancies, isolation, poverty, healthcare access, and familial culture, which were identified by the participants as sort of the key risks. Participants let us know that in normal circumstances, their abusers try to isolate them so they can't speak to their friends or their family. And as you can imagine, during COVID, this was exacerbated. Everybody had to go into lockdown, so it became sort of an out of sight, out of mind for a lot of these women. They found that they were just not seen or were able to be seen by their neighbors or by their community, and made things significantly worse for them. And we know that lockdowns were completely necessary, but it just happened to be this just happened to be the detrimental effect. Our participants also noted that abusers create these cycles of poverty when they can take control of finances. So you essentially have your authority taken away when you have your paychecks taken away, when you have your welfare benefits taken away. And then when you go to sort of pay your bills, you're not able to simply because you don't have access to your own money. And then you end up defaulting on your payments, you start having late fees, and all those costs end up building up for a victim. And all of that is very intentional on part of the abuser. It's to make the victim feel like they're losing power. And I want to highlight something that one of our participants said. Black women make 63 cents to the dollar that white men make. So you start out in a different place. Then when you try to reestablish your credit, your banks say that you're not eligible. And that's because, of course, your credit is damaged. These financial institutions aren't considering economic abuse. They're not considering that you have to pay the bills, that you're suffering spiritually, emotionally, and mentally to try to make life better, and you simply can't. So I just want to focus in on a little bit. We had a section that drove down on the financial institutions. So financial institutions, as you saw in a previous chart, they did rank last when it came to helpfulness to victims. We saw that 40% of participants didn't contact their financial institution to help them leave their current or ex-partner. Did contact, but 59% did not. So the majority of women aren't able or don't know that they possibly could receive help from their financial institution when they're in this situation. 33% of women selected them as selected financial institutions as the most unhelpful service. However, we did also see that 72% agreed that their banks were sensitive to their situation. And 71% did say that financial institutions were knowledgeable of economic abuse, while 10% disagreed. That finding, though, contradicts our previous consultations with women when we did our national consultations for the National Action Plan for Gender-Based Violence and during doing our qualitative interviews as well. And I explain a little bit about why that is during our research limitations. So the reason that we expect that they were rated highly for financial institutions' knowledge of economic abuse was that our respondents mainly came from our e-newsletter. So these are women that are already in touch with us, women who already know quite a bit about economic abuse. So perhaps they were equipped with the language and tools to ask what was needed from them for the financial institutions, who were able to explain better what was happening to them, rather than a woman who didn't know what economic abuse was. We also saw that there was a lack of diverse representation in our sample, as our sample was 80% white. And as I noted from our qualitative interviews with women of color, the experience that they found from financial institutions was vastly different. The knowledge was lacking, the ability to cater to these women was lacking as well. And of course, one of the limitations of the study is that we simply don't have any other prior research studies in the Canadian context to compare this to establish any baseline. So we had to establish that baseline for ourselves. Wow, so I feel like I've sped through this a little bit, but that just gives us some more time to answer questions. I'd like to highlight just a couple of things before, because I have a little bit more time. Was that a key way that abusers tend to isolate their victims was to get them to borrow money from their friends and family. About the majority of respondents said that they did this, but they didn't allow them to pay that money back to their friends and family. And what that does is creates hostility between friends and family and the victim themselves. And again, that's a very intentional thing. Abusers do that to make sure that victims don't have access to their friends and family, people who are willing to help them out. And again, during COVID, because people were locked down, it just fed into that sort of out of sight, out of mind mentality, keeping the victims away from their abusers. So I'm going to move on to the recommendations of our study. And we had quite a few. We also do have recommendations from previous versions of studies when we did our national consultations, but I've kept them separate for now because we're going to be publishing them in our economic resilience and abuse report for women that's going to be coming out soon. But just to start, the first thing that we need, first and foremost, was to create economic abuse material and screening tools to support frontline workers and service providers. So resources and materials like conversation tools, economic abuse screening tools for support workers, for financial institutions and healthcare workers. These types of things are really essential to support victims and survivors. There is really an evident need to develop these materials for prevention and as well to respond to economic abuse and coercive control. Number two, the biggest thing, like I said, that we found was that there was simply a lack of funds to go around to all of these services. So we ask for governments, for local governments, for policymakers to allocate public funds to improve access and quality of family law services in particular. During the pandemic, we understand that governments had to reallocate funding that was essential to services in public health. And we've seen this from past literature as well. Again, when it comes to previous pandemics, global pandemics, not global pandemics, excuse me, so the Ebola pandemic in West Africa and such as Hurricane Katrina, governments tend to allocate services directly to emergency services, but then women's services tend to be wildly underfunded. But as a result, what happens is these women and families, I should say, who need this help end up getting left behind. And in fact, their situations worsen significantly. And then the catch up from that is much worse and much more costly than it would have been if we had stemmed that gap earlier. So as a society to be able to move forward and build back after pandemic, this is absolutely key and crucial, especially for legal aid services for Black, Indigenous, and women of color in particular. Allocate funds to improve access to affordable childcare. Childcare was a major sticking point among the participants. There was just a lack of affordable childcare across the board, and especially for children who had special needs. We had one participant in particular who had 2 special needs children, but she couldn't find childcare that she could afford. She had already left her husband and had to go to a shelter. The shelter ran out of beds, so they had to move her to a hotel room. So she was locked in a hotel room alone with just her 2 children. So you can imagine sort of the toll that it takes on one single person to be in just one single space with your children, and the impact that it has on your ability to work or ability to work from home. And the only childcare that she could find for her children, because their special needs, were on Saturdays and only for a few hours. So this is really key to be able to help these women get back up on their feet. Our 4th recommendation is to provide funding and programs for services for vulnerable women, especially from the Black, Indigenous communities and women of color, older women as well, and immigrants. we, as I said before, shelters, women's shelters, homeless shelters were underfunded and just over capacity. They simply didn't have the time or the resources to be able to dedicate to the huge demand of people that needed their services. Our participants noted constantly that firstly, to have the courage to be able to reach out was a huge obstacle. And then finally, when they did have the courage to be told, you know what, we can't help you because it's COVID, and yet you still need help. So these services absolutely must be bolstered to help these victims recover. And in the qualitative portion of the study, Indigenous women also note that there's a specific lack of programs for Indigenous women's experiences with abuse. From our previous research as well, from our national consultations, we know that Indigenous women, or some Indigenous women, don't live on paper because bands and councils tend to hold their assets. So they face exceedingly difficult challenges and very different challenges than the general population. Again, we also heard that, like I said before, that elder women were a demographic that slipped through the cracks, and immigrant women also need culturally sensitive services as well, because finding those services were particularly difficult. So these services need to be expanded and bolstered within the region. Another major sticking point for or pain point for participants was affordable housing supply. So I think everyone has seen that there's been a housing crisis across Canada. We've seen average housing prices increase during COVID-19. Just over a year, from 2020 to 2021, it's increased $200,000, which is affordable for most Canadians, or the average Canadian, but it makes owning a home or even renting a home impossible for these women, like almost a fantasy. Especially because so many of the houses that we saw in the market got bought up by investors, by speculators, people who would buy a home and then immediately put it up for rent just a few weeks later, also causing rental prices to increase as well. So we need to see policies from policymakers to make renting and buying housing affordable for the people who are actually going to make these places their homes and not use them as investments. It's absolutely crucial for women and families to be able to build back after they've left an abusive situation. And it's just something that we didn't see during this pandemic. Our sixth recommendation is that we absolutely need to provide financial institution staff with training and introduce policies on domestic violence and economic abuse to better assist survivors with the division of finances when a relationship ends. We've seen that when abusers leave, sometimes if an abuser leaves or if the victim leaves, the finances can be the last thing that the victim is thinking about. However, it can be the first thing that the abuser is thinking about. So if a victim leaves, sometimes the abuser will take all of their money from the joint account, even if the woman was the breadwinner or even if the woman was working and contributing to that joint account, they will take it and they will leave the woman with nothing except for debt. So we absolutely need policies and procedures for financial institutions to be able to help these victims. We know that financial institutions in Canada do have procedures for elder financial abuse. So when senior citizens experience family or relatives taking control of their finances, but there is a lack of services and a lack of policies for financial abuse in the domestic violence context. And we've heard as well from financial institution staff previously that they can also often be the first line of defense against abuse, because people tend to get very personal when they meet with their banking specialist. They tell them all their personal stories around finances. We've heard from banking specialists themselves that they know when sometimes they can even see the abuse that's happening but they didn't know that there was a name for it. And they don't know how to escalate the situation. So how do they contact the authorities? How is there a way to escalate it within financial institutions themselves, or to flag an account? There's simply just not that, that procedure there. Also, the participants in our study noted that the financial institutions weren't as protective of their privacy and security as they could have been. So again, when there's a second name on the joint account, there can be assumptions made that these two people are within contact with each other, are on good terms with each other. And so information tends to flow both ways. And that can be extremely dangerous, especially when a victim has fled an abuser. So our seventh recommendation is to provide free and accessible credit repair and debt remediation services for survivors. And as we saw already, 90% of victims within the National Capital Region had their credit cards stolen, their money stolen from them, or abused. And so as a result, these women's credit scores are often severely damaged. But you need your credit score to be able to do anything. You need your credit score to be able to get employment, to be able to rent a home, to be able to buy a home. So it completely destroys a woman's ability to be able to build anything back after they've left. So we absolutely need financial institutions to provide free credit repair and accessible debt remediation services for all survivors, including survivors of diverse communities. This includes services like even being able to close a joint credit account without impacting your credit score. We think that financial institutions need to work with survivors to develop flexible and achievable repayment plans. And even things like taking off bank account opening fees and things like that for abuse victims really helps in giving the victim a second chance at building up their finances again. And our eighth and last one is to make available information regarding family law procedures and women's rights for all service providers. So participants noticed that there is just a scarcity of resources and information and protection from legal services and just all services across the board. So we need to be able to make these services available. We recommend that service providers be equipped with necessary training and informational tools, such as screening tools, to be able to figure out whether or not a person is being abused, and to be able to help these victims get back up on their feet. Because like I said, even the women themselves sometimes don't know that they're experiencing economic abuse. So this is something that would be life-changing for a lot of these women. So it looks like I have finished early, so we can move over to our question and answer session. I'd just like to thank Tracia Bedard, who will be with me answering questions, and who I believe has been answering questions in the chat, if anybody's been putting any questions in the chat. So I'll open it up to the floor for everyone. If anyone wants to raise their hand, or if anybody has anything they want to note or even discuss about the findings, or if there's anything else that you'd like to know. All right, amazing. As always, you can always feel free to reach out to any of us at info@ccfwe.org. Jen, thanks so much for your question. We will be sharing the slides out after the presentation. We might be able to get it out to you over the weekend or on Monday, but we should be able to send those out to all the Eventbrite participants. Kathy Cowan, thanks so much for your profound research. Were there any startling findings for you? Yeah, actually there were. there were a couple of things that were a bit surprising to me. There was one thing, actually, I'll share my screen and I'll show everybody. So when we asked participants about whether or not they were worried about their employment and economic situation and their financial situation and housing before, during, and after the pandemic, we actually saw a little bit of a decrease. So I'll show you guys here, hold on. So if you see here, when women were thinking about whether they were worried about their housing situation, for example, during the pandemic, that agreement actually drops very slightly in the agree section, and it goes over into neutral. And we kind of saw that trend across when we asked women about employment and education and their economic resources in general. It was still very high. It was still the majority of people who agreed with that statement, but it just dropped and it shifted a little bit into neutral. And I kind of theorized that, our team sort of theorized that that was perhaps because of lockdown, the abusers had to remain where the victims were, in the same place, in the same housing, and even reliant on the victim themselves, because the victims would also be bringing in money. So they couldn't as easily enact those threats with the victim. It's almost as if they realized how reliant they were on the victims themselves. But that's just one of the theories that we had. Any other surprising things that came out from the study? I wonder, Tracy, if you had anything that was surprising.
I think that when we were looking at the helpful and unhelpful institutions, I was surprised that some people, the participants, had rated banking institutions to be as helpful as they did initially. Like, looking at the data, I was expecting it to be a bit lower, just because of like those consultations and like even what we heard in the qualitative interviews. So I was surprised by that, but I don't recall anything else that was overly surprising. That was just one thing. I was like, oh.
Yeah, that was a big shocker to me as well, because that very much was a different story than what we've heard from women on the ground, for sure. It's very different from what we've been hearing from women for years about the financial institutions. So that was definitely unexpected. I think another thing for me was that a slim proportion of the respondents, when we asked about emergency funding, about 20%, I think, or a quarter of women actually received funds from a charity or a nonprofit or a trust. So it just goes to show how important our nonprofit sector was during this pandemic, to be able to give these women even funds to live their lives. So yeah, so those were some surprising findings for me. Let's see, did your research look at the role of legal professionals and their role as advocates for these women at all? So we know that, just to answer your question, Sarah, we're in touch with some amazing lawyers ourselves, from our National Task Force on Economic Justice. And we know that these lawyers are also looking for ways to be able to help these women who are in abusive relationships, and the problem is just that they don't always have the tools, which is why we recommend that screening tool, to be able to see, well, is this person going through an abusive relationship, through an economically abusive relationship? And lawyers are also sometimes they can be frustrated with court proceedings and the way that the courts can rule on certain cases, when it comes to child support payments, or when it comes to welfare support payments, when it comes to keeping the victim linked to the abuser, which can be really harmful for the victim themselves. So that's something that we've heard from lawyers and legal professionals previously. For this particular study, we didn't look at their role as advocates, but it's definitely something that we'd like to drill down on in the future. Let's see, no problem. All right, so before I let everybody go, I want just to let everybody know that the month of November is the Canadian Centre for Women's Empowerment media campaign called Help Us Rise. It's to raise awareness across the country about economic abuse and about financial abuse. November 26th is the National Day for Economic Abuse Awareness Day. And on that day, we're going to be having a series of events. So we invite you to come and register for those events. We would love to see you there. Please spread the word on social media. Please spread the findings of this report that you have to all of your colleagues who might benefit from it. I hope you stay safe. I want to thank everybody again so much, and thank you to just our support staff and Dr. Neha Gupta, who was here with us, Tracy Bedard, who's one of the researchers, and for all of the administrative staff who's in the background doing all of the tech support. So thank you so much.